Welcome. Today we're doing taping, kinesiology taping for scar tissue. I've got two different taping techniques to show you. One is for like a fresh scar and how to help it heal a little bit better. So it's like diminished visibility of the scar itself. And the second tape is to actual increase mobility of the scar tissue in the area. So if you're the connective tissue underneath the dermal layer is adhered, that means the skin won't move freely between like the skin and the fascial layer and then the underlying muscle belly or whatever the tissue is underneath. If you get like resistance in there, there's ways to go about that taping wise. As well as I'm going to show you some manual techniques for it. So the taping helps accentuate like some of the manual work you do, and I'll talk about some products and stuff you can do that are natural to help with minimizing scar tissue, the looks as well. Okay, so let's get started. So the first thing we're going to do is we're going to talk about a fresh scar. So you get like a cut or a scrape. It's finished healing, so you don't have the scab anymore, that's gone, and then you're left with a pretty like whitish sort of, or a discoloration of the skin, but it's finished like its layer, so it's going to basically repair from the inside out. Sometimes the scars don't really go away. They're supposed to. There's an actual, you've got one cell that establishes the scar tissue, so that's the fibroblasts, and then you have fibroclasts in order to break down, because when there's one, there's the opposite. But for some reason, the fibroclasts like to take union breaks, and they just don't like to do their job a lot. So sometimes they don't actually break down tissue or scar tissue. You recycle it. So we want to use like manual work to help break down the tissue manually through therapy, and then let the fibroclasts break down the scar tissue into, and then recycle it for use later on. And then after you do the manual work, you put the taping on it to help accentuate what you've done for that session. So we've got a fresh scar. I've got a bunch of scars everywhere really. I've got one there, and then got one on my bicep here as well. I'm gonna say I've had a hard life, I guess, like cutting myself. It's not from actually cutting myself, it's not what I meant, but yeah, just banging up using your hands and stuff, right? So let's get to we'll get to the manual work basically. So if you have a scar formation, it's fairly new. What you'll want to do is typically make sure it's moisturized. So whether you have moisturizer, one that you like, a lotion or something. But if you use something a bit more heavy duty, especially with scars, so we're talking like use like butters, not like butter you eat, but like shea butter, or I got some aloe butter here. I'm going to demonstrate here so you can see what it looks like. Coconut oil is another good one. Aloe butter, which I'm using here. There's palm butter. There's all kinds of different butters that you can use. It's like a thicker sort of thing. Some of them leave a film, a protective barrier. They don't absorb fully. So just be aware, if you have that on, the tape's not going to stick to it. So you're going to want something that absorbs almost completely, if not completely. So I've got aloe butter here. I'll demonstrate here. It goes on pretty easily. It's hard initially at room temperature. Can't even get any out. That's good. There we go. So you can see it's like hard at room temperature. So coconut oil and that would be, shea butter be very similar. I'll just put it on the scar there, so you'd have like old scar, new scar, whatever, stretch marks, dry skin. It does a lot. You can see it's like glistening there because it's finally melted because of my skin temperature. So anything above skin temperature. So I'm just gonna move that around everywhere. Great for the skin, so you're talking like vitamins, minerals, vitamin C, all this fun stuff to help with kind of feeding the skin in a way, keeping it healthy. And so it could take a number of minutes, 5 minutes to 30 minutes or so to kind of fully absorb in there, but depending on the butter, aloe's pretty good. It actually absorbs in pretty good. So while that's absorbing in, I'm going to discuss a little bit about the taping. The other thing you can do is frictions. So this is a technique that you have an established scar and you want to break down the tissue because your body's obviously not breaking it down. So it's probably a really old scar. And what you'll do is you'll just take a finger or a thumb and then you'll just kind of go over it in the different directions depending on like where the resistance is. So if you feel resistance, you just kind of like pull on it, and if you see the skin pull immediately, then that's like resistance. And sometimes there's like a stretch, which is that you don't have as much resistance. There's like an initial movement and then a pull, but if there's an immediate movement of the skin, then it's because it's stuck. So you'll want to go in the direction of whatever it's sticking. So you just go friction for about a minute, about a second for like one movement back and forth. So it looks like that or like that, just friction for like a minute. And what you're doing is you're just kind of creating heat. You're adding stress to the scar tissue, hopefully actually physically breaking down the tissue. And when you're using something like butter onto it, shea butter or coconut oil, you also help loosen it. Also, castor oil has been known to be excellent on scars and is really cheap actually. So find some castor oil as well. But that usually has like a barrier, so just save that for when you're not like taping. But if you use like a butters tend to absorb a lot better. So shea butter is excellent. So okay, we got that absorbed in. You can see there's like a little bit of glistening there, so there is a sort of surface barrier. We'll see how the tapes hold up to it. I'm actually surprised if you get a decent brand tape, or just decent quality tape, it'll stick on anyway. So the first taping we're going to do is just for an established scar, so one that's developing. So say you just lost the scab and you're just going to do the taping. So what we're going to do is just tape basically the length of whatever the scar is. So I've got this sort of discolored old scar here, which is an old scrape, and hopefully you can see it. It's like this whole area here. So I'm going to tape that. And what we're going to do is, since it's not super wide, usually scars are like cuts or stuff like that, so they're not like super wide. So you might want to just cut the tape lengthwise. So I'll measure it. It's about that. No stretch, so you can cut to length straight away. And I'm going to use half of it because it's only half as wide. If the scar area is wider, obviously you can. You don't have to cut it in half. Remember, this isn't a band-aid. It's not meant to like seal a wound or anything like that, right? So it's always after the fact. So we're going to do no stretch. The middle part becomes an anchor. So we move from there. So immediately, whichever length it's going, so in this case it's horizontal. So I'll just put that right on top of it, right in the middle, apply it, and then I'm just going to pull the ends. No stretch. Anchor it, and then you just put a bit of friction. I'll use the end on it there and rub it in. Now in this case, you can see it's not really sticking. I can see it's not really wanting to stick. So it's a great example of how you don't want to really put it on something that's a barrier. I would wait another half hour probably, and then I'm already seeing it's absorbing it. It's becoming less shiny. But obviously I want to do this in one take. So you'd wait probably half an hour or so, or do it when you're not like moisturizing, so maybe a couple hours later or whatever. Or you can clean the area as well. That's fine too. It's starting to stick actually. There we go. I'm always surprised with tape, and then you can have one for later, obviously. So you can keep that on for a number of days. Even up to like 5-7 days, as long as it feels okay, it's fine. It's not going to do any harm there, right? It's because there's not a lot of movement. Now I'm going to peel that off, and then I'm going to show you. See, it's actually pulling quite a bit, so it's sticking. It would have stuck on there. So I'll show you now taping for mobility with the scar. So what you want to do is just put a finger on the scar, so wherever it is. We'll use this one here. Yeah, well actually this is a more of a broad surface, but so you can see it. So I'll just put my finger on it, and then what you want to do is move in a direction and then see if which doesn't give you any give. So if it pulls immediately on the skin and all the way up, then you know it's like there's resistance in that direction. So I'm pulling up towards me. There's a bit of resistance. That's not bad going down, because it gives and then starts to pull, whereas it's immediate. It's almost immediate coming up. And then you go to the side. So the sides are pretty bad too. So you're gonna pick whichever side, and it might be multiple side, it might be every side that's just hideous, but pick one for that time being, and then you can rotate through like every 2 days or whatever, and just rotate. This is like a work in progress, right? Because the scar will be there for years, so it doesn't matter if it takes days on end of taping differently to get a result, right? So you're going to do Y tape on that, and you're going to tape in the direction of the resistance. So you're not going to tape exactly, you're not going to tape the scar, but you're going to tape at the scar or just before it, because we're trying to influence the skin around it. So I'm just going to tape a Y, and we'll just have like a little base anchor area, round off the edges, just like that. Okay. Now we're going to anchor the fingers first, and they're going to be away, so the furthest away, whereas the part here, the part that connects on the Y, that's going to be the base where we're going to stretch it up into the scar, and then we're going to get it to pull. We're going to add a little bit of advanced pull on the scar, and then plant it so it can hold it into that pulled position. That pull provides constant stress, and then hopefully at a microscopic level it'll break down the actual adhesion, the bonds within it, just by constant strain on it. Okay, so in this case, so every direction is pretty bad, so I'm going to tape it. I'm going to tape it actually up towards me, because there's not a lot of give there. So I'm going to start with putting the fingers down here. Okay. And it's going to be kind of like a Y. So it's going to stretch up into it, so I want to have it kind of low. And this could have like quite a bit of stretch, considerable stretch, so I don't want to be too close to it, so I can stretch it up and towards, like that. Okay, so there's, so far, the scar tissue is right here, so I'm going to bring it up with the base. So I'm just going to grab the end here so I can tape it. So make sure your anchors are solid before you pull. Obviously I'm putting like hello butter all over my arm first. So this might be a bit, so I'm just going to pulling considerable stretch, and then I'm going to park it there. There we go. And just up until you can see the scars like right there. So it's a little bit harder when you're doing it yourself, but at least, I can show you how to do it. If you're doing it on a client, you want to like pull the scar towards the direction and then plant. So let me do one more with that in mind, just so we're thorough on it. So I'll go in a different direction so you can see, so you have an idea of what that looks like. So fingers, doesn't have to be super long, around the ends, just like that. Just going to break off the fingers first, like that. Okay, so we're going to go the opposite way. So I'm going to start down here. Here's the scar right there. So I'm just going to spread that out there. there. And then as I stretch up, so it's anchored at the bottom, I'm gonna pull it towards here. Now what I can do is pull the scar towards the general direction that I'm trying to get it to go. So it's like a pre-pull. This becomes difficult because you only got like one, in this case it's one end. If you're doing it on your knee or something, then you can just hold the scar towards the direction and then pull with the other hand. But you know, this happens sometimes, right? So in this case, I'm just gonna stretch with my thumb, pull up, drop. You just do the best you can. Oh, and then pull. We're getting tricky. There it is. So I managed to pull that off on an arm by myself. So good stuff. Rub it in just to help with the adhesion. And that's it. You can see it's as I pull the scar back, it already starts to stretch out the already stretched tape, and then it just flings it back to the spot, and then I can go towards the tape, and then it collapses onto itself into like a neutral position. So it's going to have that constant pull on the skin. Hopefully that breaks down the tissue. Any questions or anything, just leave it in the comments below, and hopefully that's clear. I'll see you next time.